Does kyphosis cause lower back pain? We will talk about what kyphosis is, first of all, and it's in the upper back. So can things that affect the upper back, like kyphosis, cause lower back pain? If you don't know who I am, my name is Dr. Ryan Peebles, and I've dedicated the last 20 years of my life to better understanding and reversing the root causes of chronic lower back pain. Yes, kyphosis can lead to lower back pain and also neck pain. So what is kyphosis? First of all, kyphosis is a forward bending curvature. And so we have natural kyphosis in our spine. The thoracic spine is where the rib cage starts and goes all the way down to about here. And that's where the lumbar spine starts. And so the kyphosis, the natural kyphosis in our spine is in the thoracic spine. If I were to go ahead and over-exaggerate this curvature and make it more curved forward, that would be, you could call that a hyperkyphosis. And that tends to happen in us because of our chair-laden lifestyle. If I go ahead and exaggerate it, that forward bend there is kyphosis in this curve. And so if I were to straighten up my posture, I'm straightening out that kyphosis. And so what is most common for an abnormality is exaggerated kyphosis. So that's where we get the hunchback, that's where we get the rounded shoulders, riding in a car, watching TV, we tend to slouch and then we have to kind of lean forward. If I lean back here and I'm leaning back on the couch and then I don't want to look up at the ceiling, I want to look at the TV, I go like this. And that is something that promotes hyperkyphosis, too much kyphosis. So, but then when you get up off the couch or get out of the car, and I mentioned the car because that's something we do in the car as well. People tend to recline the seat in the car. So you're leaning back in the car. And so you're not, if you don't want to be looking at the roof of your car, you want to look at the road, you hunch forward. And so that also promotes kyphosis. Not a problem when you're in the position, but when you get up off of your seat, and you go walk around and that curvature is over exaggerated from repetitive lifestyle habits, that can create problems. And one example of that would be when you want to look up at the sky. And I'm going to demonstrate somebody with hyperkyphosis or kind of a hunchback. Okay, so this is normal posture here. I'm going to kind of hunch a little bit. And so this would be somebody with a little bit of a rounded posture. If I want to look up at the sky and my spine is kind of stuck in this forward position, my neck really has to extend to look up at the sky. And that can cause neck problems. And if it's not my neck and I try to extend up and it's not happening through here where it should be happening, then it's going to drop down into the lower back. And so I want to look up, I arch my lower back. And that repetitive arching just to look up when you're cruising around town can, over time, cause problems. And so the answer to the question in the stream, can kyphosis lead to lower back pain? Of course, is yes. And not only can it lead to lower back pain, but it can also lead to neck problems as well. How do you reverse it, or how do you prevent kyphosis from happening? And the first thing I want to mention before talking about that is kyphosis in its natural state is okay. There is a natural kyphotic curve in the spine. This curve right here is natural, but when it gets over exaggerated is the problem. So we don't want to eliminate kyphosis. We want to prevent hyperkyphosis. And the first step is to stop doing the activities that I was talking about earlier. So if you drive in a car a lot, one of the things that you can do is take your seat from that reclined position and bring it forward. And that way your head can go from here to here. And you see what that does to my spine. And so you're thinking, well, it's not a big problem. I don't really have pain up there. But we just talked about how one example of how kyphosis can lead to lower back pain because it causes extra stress on the lumbar spine. If you want to look up and you can't extend through your thoracic spine, then it's going to have to come from either your neck or your lower back. And that is excessive stress on those areas because your body is over rounded towards the ground. And another thing you can do is be aware of how you're sitting if you're watching Netflix or whatever you do. My final solution I wanted to mention about preventing or reversing hyperkyphosis is if you are in the program, when you push away from the front of your rib cage and you are connecting it to the ground and pushing away from that spot, that motion does the exact thing that we would want to do to reverse hyperkyphosis. We're pushing away from the rib cage. So instead of looking up from my neck or my lower back, I'm going to push away from my upper front anchor, and it's really hard. It's really hard to do in standing. But if I lock in my pelvis by squeezing my glutes, and I lock that in, your glutes are really strong, one of the strongest muscles in your whole body, if not the strongest. Lock those in. Now that allows me a lot more control. I have a solid, stable foundation here. So I lock in my glutes, and now I want to look up at the sky. I can extend through that upper front anchor, and I can have the motion for my body to look up at a bird or a building, or even, if kyphosis is really bad, it might just be to be able to look forward. That motion I have a lot more control on where it comes from, and it can come from that thoracic portion of the spine and protect all that repetitive extension from going into the lower back or the neck. So if you want to help spread the word that there is a solution to back pain and that it's available to everyone, hit that like button and subscribe so we can let YouTube know that they should spread these live streams and these videos to more people and get the awareness out there so more people can help themselves, take responsibility for their own health, and get more life back.